Ladies and gentlemen, welcome to the main event.
Hey guys, Dr. Matt here, back in for another Wellness Wednesday, March Madness edition. So in the coming weeks, we're going to be talking about 16 different therapies for low back pain, and we're going to discuss which one is the best one. So I say March Madness because we got it laid out in a basketball format, a bracket format. Week one, we're going to be starting with our Sweet 16, then we'll be going on to the Elite 8, then the Final Four, and ending with the Ultimate Champion. Before we get started with the breakdown here, I want to give some fine print comments because we have 16 different therapies here, and some of these therapies I know are going to be more appropriate for certain situations, or for some people, they might argue, I got way better care with this therapy versus that therapy. I understand that, so I'm looking at this from the perspective of what's going to be best for the average Joe. I mean, for some of the matchups, we're going to have to take a look at, what's most accessible for a patient, what's most cost effective, what does the literature say as to which one would be best. If you think something else should have won or have a different opinion, please dialogue with us. We'd love to hear your comments on it, so please feel free to share those below. But with that being said, we're going to jump into it. With that being said, let's get started with the Western Conference. We're going to start in this upper left corner with spinal manipulation and opioids. So spinal manipulation, or as you may know it as like adjustments, it's kind of what you expect when you come into the chiropractic office to get treatment. We're adjusting the spine, we're moving joints that aren't moving well, getting better motion happening for you. Opioids, those are pain relievers, and very powerful ones too. Things such as oxycodone, hydrocodone, morphine. Opioids are just helping to kind of mask pain. They're not relieving the pain or discomfort. They also can be highly addicting. So not a great viable option to actually treat low back pain. So spinal manipulation gets the win in this one. All right, so then moving into our next head-to-head competition, we have diet versus NSAIDs. So NSAIDs are anti-inflammatory drugs like aspirin, ibuprofen, so common names, Advil, Aleve. Again, just kind of looking to mask the pain. We're not really fixing anything or helping heal long term. More of just a kind of a band-aid for the pain. Diet, you know the old adage, you are what you eat, right? So if we eat poorly, we're probably going to feel poorly, but if we eat well, we can feel well. And if we keep up those habits of eating well, that can really help not only with possible pain in the low back, but just our overall well-being. So it's kind of an easy nod to diet to win this next round. All right, and as we go down, we now have cognitive behavioral therapy versus surgery. So surgery is usually our last choice, our treatment option. It's the thing we turn to after we've exhausted all our conservative treatment options. Don't get me wrong, I know some people like surgery is the option that they need, but surgery can often be very expensive, can take a long time to recover from. Can also, depending on what needs to be done, we might be taking away tissue, fusing things, so our mobility might be greatly hindered in the long run. So surgery is oftentimes a very last resort after we've exhausted all our other options. So cognitive behavioral therapy might be a new therapy that you've never heard of, because it's more of a mental health therapy, and the idea behind it is taking negative, inaccurate thoughts that you may have about a challenging situation and helping you to recognize that you're thinking that way, and to reverse that to be more positive and to think more positively about a situation. For example, if my back is hurting, I might think that, if my back hurts, therefore I have a bad back. Well, cognitive behavioral therapy would help you think differently in the sense of, I have back pain, but I recognize that's because I'm sitting too long or I'm doing this certain motion throughout the day. So it helps just take a different positive spin on it to help you better reach a solution long term. So that's kind of a long-winded answer, and we hope to go through more of that in the future because cognitive behavioral therapy gets the win here. All right, so now heading down to our last competition in the Western Conference, we have dry needling versus ice and heat. Many of us know what ice and heat are. Many of us have used ice and heat. It feels good, it's cheap, it's accessible, and oftentimes I'll ask patients too who come with low back pain, did you try ice and heat? Yes, I did. It felt great, but then my low back pain went back to where it was before. So, lots of pros to ice and heat, but again, it's just kind of a nice feeling Band-Aid for the pain. It doesn't really help solve the issue for long term. Dry needling, some people might think of acupuncture because dry needling, they do use needles. Oftentimes physical therapists will utilize dry needling for low back pain. And what that's looking to do is actually get into trigger points that are in the muscle and get down to the level of that trigger point, look to help release that, help correct, dysfunction that's occurring within that muscle. So that can, for some people, be very beneficial long term, especially if that trigger point is the root cause of their low back pain. So we're going to give the nudge here to dry needling due to its ability to help long term. So now we'll move into our Eastern Conference here. First matchup is between massage and traction. Now this is going to be one of those first matchups where, depending on what you have going on, one of these could be really beneficial for you. Also, these are two therapies that when combined with something else can do even better. But we're going to try to look at each of these therapies on their own. So massage therapy, great for working out muscles that are tight, helping to bring some pain relief. Can also help kind of speed that healing process because you can help get you feeling better, therefore able to be more active in your care. Downside is, massage therapy can be expensive, oftentimes not covered with insurance, and you might need more than just one treatment to really see some progress or results with your care. Traction is great when you need it, but it's kind of a one-trick pony. On its own, the literature, just does not support that this is a go-to therapy that's going to help with a lot of different presentations of back pain. Again though, traction combined with something like massage therapy could be awesome, but on their own, the nudge goes to massage therapy. So going into our next head-to-head competition here, we have stretching versus ultrasound. So I probably don't have to explain a lot about what stretching is because many of us, if not all of us, have done stretching to some capacity in our lives. You don't need anybody to do it. You can do it anywhere. And there's lots of different ways you can do it as well. So stretching can be great to help stretch tight muscle, and also you have to move to do it. So I like it in that regard as well. Ultrasound is a modality of therapy that's been used for a long time. I've had patients who have used it and they've really loved it. It's using sound waves to help to decrease inflammation into the muscle, and the caveats with it is, it's hard to do this at home because you need a machine. You usually need somebody to perform it on you. It can be expensive, and you might need a lot of sessions of treatment to really see any benefit. And unfortunately, too, the research shows that there's not very good evidence for long-term benefits of ultrasound use. So many people have probably used it, and it can feel really good, but in the long term, it might not be the most viable option for us. So the nod goes to stretching. All right, so moving down the line here, we have exercise versus acupuncture. Now this is one of those matchups here where we have two great therapies. Again, many people are going to love both doing exercise and acupuncture, and you can get great results with acupuncture, especially for chronic low back pain. And exercise, of course, is moving the body, strengthening the body, stretching. It can incorporate all those. It can be good at preventing injuries and keeping your spine mobile. So some downsides of acupuncture is, again, it's you need somebody to help utilize the therapy. It could be several treatment options to see positive results. Versus exercise, you don't need anybody, you just need yourself. You can essentially exercise anywhere. But again, both these, if combined with something else on the list we've already talked about, together can be even more powerful for low back pain. But looking at them individually, I have to give the nudge to exercise, even though acupuncture might perform well had it been going against anybody else on this list. So exercise gets the win at a last second buzzer beater. All right, so now moving down to our last matchup, we have TENS unit versus laser therapy. So TENS unit therapy is when you're going to use a pad, either a sticky pad or a reusable pad of sorts, onto the muscle that will be connected to electrical current, and that will help to either create like a tingling sensation in the muscles or contraction of the muscles to help reduce tightness in muscles, inflammation, and bring some pain relief to the area of treatment as well. Laser therapy is going to use intense focused light into a muscle, and the idea is to again help bring pain relief and reduce inflammation. So there are pros and cons to each of these. With the TENS unit, they can be a little bit more accessible to you as a patient because there are many of them that you can buy and use at home. It can be a fairly short treatment time of like 10 minutes, and they can feel good. And you can use them kind of all over the body, not just in the low back. The downsides being, long-term effects, it's, again, maybe a fancier Band-Aid for that pain because it's not really going to help cure anything, or evidence does not show that it helps for the long term or long haul. Laser therapy, plus sides can be kind of opposite of that TENS unit, that it can help longer term, what the literature shows, especially in combination with other things. It can be very beneficial to the low back. However, it can be expensive. You need the right equipment to do it, and you may also need multiple sessions to see that improvement. So this is kind of a tough one. Again, good battle back and forth, but comes down to that last second shot, and we're going to give it to laser therapy because of the ability to actually provide more longer lasting pain relief in the low back. All right, so that's the end of the round one with the Sweet 16. I look forward to going through the Elite 8 with you next week. And remember, we are always here at Venture to help you move better, feel better, and be a better you. You guys have a great week. We'll see you next Wednesday.